Welcome to today's press briefing. We have with us Dr. Albert Tao, Principal Medical and Health Officer, Communicable Disease Branch, CHP, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Ao, please. Friends of media, fellow citizens, I'd like to report the COVID-19 cases 316, 68 cases were confirmed by the HA, 48 by the Public Health Laboratory, and the remaining 200 were confirmed by the private laboratory. And for RAT positive cases, 297 were confirmed as positive. Altogether, yesterday we registered 613 positive cases. As of now, for the fifth wave, we have confirmed 1.15 million cases, 742,000 PCR positive, 442,000 RAT positive cases. 13 were imported cases. Remaining 600 are locally acquired cases. Of the 13 imported cases, 9 were picked up by the airport specimen collection station. 4 cases were from France on TK083. Since there were 4 cases on this flight picked up at the airport, the CHP invoked 599 to require the Turkish airline to suspend the flight from Istanbul from 19 to April 25th. MH075 from Kuala Lumpur, there was a case on this flight. There was a COVID positive case that was picked up at the airport. There were 4 that failed to measure up to CAP 599H requirements. The CHP also invokes CAP 599 to require Malaysian airline to suspend the flight from Kuala Lumpur to Hong Kong from the 19th to the 25th of April. Other than these 9 cases, positive cases at the airport, there are 4 imported cases. They were picked up at the quarantine hotel during quarantine period. There are 2 on day 5 test PCR positive, 1 day 3 test PCR positive, and 1 day 12 picked up PCR positive at the testing center. We have conducted genome sequencing for 248 cases. No L425R specimen were found. 241 tested negative for L425R, meaning that they are Omicron cases. For the remaining 7, the viral load was low. In terms of care homes, there were no cases arising from care homes that had not experienced any previous cases. Yesterday, 11 care homes that experienced outbreaks before that reported new cases involving 9 residents, and there were 4 RCHDs that experienced cases. There were 6 residents that were reported. In terms of death rate in the 5th wave, 8,946 death cases were reported, up by 20 on yesterday's. As of now, the case fatality rate is 0.75%. Those aged 80 or above, the rate is 10.4%. The age range between 11 months and 2, median age 86. 8 children were involved. Those between 18 and 59, 3.8% For the remaining, they're above the age of 60 and above, taking up 96.1% of the total. 71% of the death cases involved 80-year-olds and above. In terms of vaccines, for death cases, 72.7% of the cases never had any vaccines. 15.4% of the cases had one shot of vaccine. 11.9% had two shots or above. In terms of case fatality rate, for those without any vaccination, the rate stood at 3.01%, one shot, two shots, and three shots. The case fatality rate is 1.6 and 0.04% respectively of the total population. For those with three shots of vaccines or above, compared with those without any vaccination, there is a difference of 75%. For those aged 80 or above without vaccination, it is 16.4%. With one shot, two shots, and three shots, the case fatality rate was 6.9, 3.8, and 1.05% respectively. Those with three shots of vaccines and above, compared with those without any vaccination, for the 80 or above, there is a difference of 16%. Dr. Ho, please, about the hospital authority. 8,316 COVID-positive cases are treated at the North Lantau Hospital HKICC, the HA Infectious Disease Center, and AWCTF for treatment, who have reported one in critical condition, 3 in serious condition, and 49 critical patients are in ICU. As said, over the past 24 hours, 17 COVID-positive patients have passed away, 9 male, 8 female, ranging in age between 50 and 97. For those who passed away yesterday, 6 came from care homes, 10 without any record of vaccination, 5 had one shot of vaccine, 1 had 2 shots, and 1 had 3. 14 age above the age of 65. There is one who was a little bit younger, who passed away, and there's a 50-year-old male. He had long, chronically ill. He had a drinking problem, and he had psoriasis arising from alcohol and duodenum condition and other liver problems. And that caused serious complications, and sadly he passed away. Because of a time lag, we reported between February 23rd and 19th of April, there are 3 diseased cases which have yet been announced. All of them are males, ranging in age between 71 and 83. Over the past day, 408 patients have recovered and been discharged, and 4 patients were picked up upon admission screening to be COVID positive. 5 co-patients are listed as close contacts. For staff members, 21A33 staff members have been infected, and 20,820 have been back to their posts. Since schools are back to in-person classes, in order to tie in with the government arrangement, the designated clinics will, starting from tomorrow, will reserve certain quota for COVID-positive patients from the primary schools and kindergartens. The family members can make an appointment during the office hours, and they can ring up the priority quota hotline for appointment.
And they can seek medical service. The HA Go software will also be deployed to contact children's parents or their caregivers. We will also provide telephone support. Nurses will assess students' health condition and will provide relevant information and support. Depending on the need, they will also suggest patients to visit our clinics, or patients may be referred to our remote medical service center, where there will be medical teams online to provide support. That would conclude my report. Before you raise questions, please identify your media outlet. Now TV, regarding the rate of confirmed cases, how would you interpret the figures? Are the figures coming down quick or slow? And the 3-digit confirmed cases, how long will this remain? Will there be some point where figures can come down to a lower rate? And regarding imported cases, are we seeing an increase in the imported cases? Could you provide some information on this scenario? Now, experts have also commented on universal testing. It has been said that we don't need universal testing. So what is the government's stance on universal testing? Is it necessary? And is it an opportune moment when we have 3-digit confirmed cases? Do we need testing? Thank you for the questions. The first question is about the trends. Now we see that the situation, we see a slow trend where the figures are coming down over the last few weeks. And in recent weeks, the figures have been lingering at 1,000 or between 600 to 700. It's at a stable level. But the actual figures are still at a high level. And you recall in the second wave at the peak, we were only talking about 150 cases, but now we are at 600-700 cases. So the figures are still quite high. Today is the last day of the long Easter holiday. We need to keep an eye on the figures. There have been more public gatherings, and there might be a small uptick in positive cases. So we still have to pay close attention, and there are no indications that there is an increase, and we hope that cases can continue to come down. But when will we see double digits or a lower figure? It's hard to predict. If there's no rebound, or if we maintain this level, then maybe in the short term we might still be hovering at the 3-digit level. Your second question was about imported cases. Currently, every day we have some roughly 10 cases. So for arrivals in Hong Kong, we have more than 1,000 on daily. It's about 1%, and that is a predicted level. We have more people returning to Hong Kong. We'll have a higher probability of imported cases. So 2/3 of the cases are detected at the airport. The majority of cases were detected at the quarantine hotels, and the government has stringent policies to prevent imported cases. So for these arrivals, when they are tested positive, we can arrange them to be quarantined at hotels. Your last question was about universal testing. Now, previously, the government had stated that we've done some preparation work, and in the future, whether there will be testing will depend on the development of the disease. Our local testing capacity has been enhanced. We have to consider the impact on the public, so we need to keep a close eye. TVB. Tomorrow, primary schools will resume. How will you assess the impact? What recommendations do you have for parents and teachers? HA, have they surveyed the strategy, or have they assessed the strategy for quarantine children? Now, can parents accompany the children? Do we have designated hospitals to accept children, infected children? And lastly, at the end of this month, when the vaccination passport requirement will be raised to 2 jabs, but the government said that the new policy will only be implemented in May. So what obstacles remain, and how can we have a seamless integration? Regarding your first question about resumption of school tomorrow, primary school and international schools can resume school in phases. The Education Secretary stated yesterday that the majority of schools, they might not resume school, they might still have Easter holiday, but we expect some schools will resume in phases. So when they return to school, they will be gathering and there might be risks of infection, but most importantly, we need to have risk control measures. So we've worked through Education Bureau and notified all schools in Hong Kong that students, before they return to school, they have to do a RAT, and that can prevent infected students from entering campus, and we can prevent an outbreak in school campuses. So tomorrow we'll resume school, and I urge parents, if your children need to go to school tomorrow, then you need to prepare your RAT test kits, and tomorrow morning when your children wake up, before they brush their teeth, you need to collect their samples and do a RAT test. Now, if you've never conducted a test, you need to prepare. You might need to read the instruction manual and study how to do the test. So we'll keep a close eye on it. When there are positive cases, parents need to notify us through the online platform, and we can undertake measures. We also require schools to report on a daily basis whether there are new cases. They need to report the number of cases. If we detect any anomalies, we will conduct investigations. We suggest also schools to take more precautionary measures. Your second question, I'll defer to Dr. Ho regarding the recovered patients. We will disclose the procedures for the QR codes on. Now, when children need to be admitted to hospital, usually we have quarantine facilities in the pediatric section. So if the parents are also infected, when it's feasible, we'll arrange them and to be admitted in the same ward. But if the parent is not infected, then when feasible, we can, if parents cooperate, so they can accompany the patient. Now, regarding resumption of school, the hospitals have set aside facilities to admit patients. So, as with previous practice, we will allow parents to accompany their children if they're willing to do so. Now, just now we mentioned that there are different quarantine facilities for pediatric cases. For special circumstances, some patients, their condition might deteriorate, they might need iron lung, and we can refer them to the children's hospital. So this is a logistic arrangement. So for serious cases, as we said just now, we have the multi-level certification, and if necessary, we can refer them to the children's hospital.
Lady in the middle over there, please. Cable TV. This morning, Professor Ivan Hong mentioned three second-generation inactivated vaccines that are on clinical trial in Hong Kong. How effective are these vaccines? Do you advise people to take the fourth shot using the new vaccine? Now, there is a case mentioned a moment ago that was picked up on day 12. Now, do you think we have to review the way in which we deal with these cases because it's past day 7? Now, also the public mortuary, how many bodies are stored and how long will the bodies be there for on average? I heard that some bodies are getting moldy after a long period of storage, and the family members failed to identify them. And some said that the temperature is not low enough, and therefore the bodies are liable to get moldy. How are you going to improve the situation? Right, 3 questions there. The first one is about the new Omicron-specific inactivated vaccine on clinical trial that has been approved to go ahead in Hong Kong. This is a new vaccine. This is still on clinical trial. It has not been rolled out to the market. The CHP, of course, welcomes these kind of trials to take place in Hong Kong because they're making a scientific contribution. As to whether this vaccine is going to be used, it all depends on the scientific data, the safety, and so on. I'm sure that when the vaccines are ready for use, the scientific committee and the expert panel under the chief executive will then have regard to the effectiveness, the safety of the new vaccine and make the necessary recommendation. As to the case that was picked up on day 12, we have conducted preliminary investigation for cases imported cases that happen in the community. We would look at the details there. There were a number of such cases before, but for this case, on March 12, the case left Hong Kong for Canada. On April 5th, the case came back to Hong Kong via Tokyo, and the case has completed 7-day quarantine and tested negative. And same could be said about the family members. And according to the regulation, on day 12, the patient turned up for testing and tested positive, but the CT value is more than 35, and it is likely that this is a re-positive case. And for cases like this, we would see whether the patient acquired from the community or whether there was any situation of transmission in the quarantine hotel, and follow-up action would be taken. The last question is about the storage of dead bodies. The DH, in fact, has received a lot of bodies. They're deceased patients from the public hospitals, and they were sent to the public mortuaries. And they are stored there on a temporary basis. And some of them, upon receipt, were experiencing some decomposition. That we do have very strict temperature control at the public mortuary. We have to make sure that it is between 4 to 6 degrees Celsius, and the cold storage has been operating smoothly. The decomposition is quite inevitable for the dead bodies, and there are various factors that would be at play that would influence the pace or the speed of decomposition. The storage facilities are there to store the bodies on a temporary basis, and they are decreasing, or they're slowing down the rate of decomposition. Now, if the bodies are stored in the public mortuaries on a longer-term basis, then the decomposition would certainly affect the look of the bodies. So we're encouraging the family members to collect the bodies as soon as possible. The government is fully aware of this particular need, and the relevant departments are following up on this, and they're coordinating this area to speed up the process. The lady over there, please. Mingpao Daily. Dr. Au, a moment ago, you mentioned the imported cases that turned positive on day 12. What is the age, the profile, the vaccination record, and whether there was any record of infection, and what variant was he suffering? Is the variant consistent with the variant that is prevalent in Hong Kong? And how many passengers were infected on the same flight? Which quarantine hotel did he stay in? Any other confirmed cases on the same floor? If so, how many? And according to your procedure, would you be contact tracing more for cases like these? And where did the patient go to after quarantine period? Now, Dr. Au, you mentioned a number of such cases. Is it the case that you have seen a number of these cases after we impose a 7-day quarantine? What are the details? If there are a number of cases in this category, do you see the merit of reviewing the 7-day quarantine? Now, this question is for Dr. Ho. You mentioned the designated clinic. Some quota would be reserved for kindergarten and primary school children. What is the quota like? And what is the utilization rate of these designated clinics? You mentioned that there are some beds in different hospitals reserved for the COVID patients. If there is a rebound and if there is the onslaught of the 6th wave, how many pediatric beds would become available for this purpose? Right, on the first question, day 12, the positive case picked up at the testing center. This is a 10-year-old female girl, 10-year-old girl, together with family members on April 5th. She came to Hong Kong from Canada via Tokyo. I don't have any information on the flight passengers with me, but I'm sure if there are, they must have been quarantined or isolated. She stayed for quarantine at 4 Points Sheraton in Tung Chung, and on the same floor there were no other infection cases, and she went home after the quarantine period, and her family members tested negative. Now, for this 10-year-old girl, she is unvaccinated, but she's asymptomatic. On day 12, she tested positive. The viral, the CT value is well over 35. We figured that this might be a re-positive case. According to our tiered triage treatment protocol, if she is not suited to home isolation, she can be arranged to have community isolation facilities. Now, previously on day 14, we did identify some returnees who tested negative after day 7. Most of these were re-positive cases. After April 1st, we have registered 4 such cases. We have conducted investigation. All of them were re-positive cases, meaning that earlier in overseas jurisdictions, they probably got infected and recovered, and they tested re-positive during the testing. They are not highly transmissible, or they are non-transmissible at all in some cases. We would certainly conduct the investigation to ascertain whether they are new cases or whether they are cases transmitted during the hotel. Now, all these cases would be subject to genome sequencing, and these are new cases. We don't have the information yet.
It's included. Our information indicates that their family members were not infected. there was no previous positive record. Regarding the designated clinics, we have 28 clinics, and they provide more than 4,000 quotas every day. We've set aside more than half for high-risk patients, and we've set aside a care hotline. So we have extended the care hotline to include primary students and the kindergarten students. As of 15th of April, we have catered to 10,000 patients and provided service to them. Now, regarding the bed space in the Children's Hospital, we have an estimate. According to Hong Kong U forecasts of infected cases in the past, from our experience in the fifth wave, each cluster, the population in each cluster, the number of pediatric cases, the proportion of children for each cluster, we did some calculations, and amongst the different clusters, there is support amongst the clusters, and if necessary, we also refer to cases to North Langtao. They can support us. Now, from the parents' perspective, when they conduct RAT tests in the morning, and if the test is positive, they do not need to worry. They need to notify the school, and they should not go to school. And if there are other children in the family, they should also not go to school. At the community level, we have a lot of support. Now, Dr. Ao can comment. The parents can submit their information through the online platform, and we can provide a lot of support. We have 183-6115 hotline where they can seek information, and aside from reporting their positive case, typically children will have symptoms such as a fever, sore throat, and coughing. So when they have these symptoms, then they can make an appointment with the designated clinic. They can call the care hotline, set an appointment date, and a doctor can diagnose them. We can also provide some medical relief. So aside from the designated hotline, our care hotline will be managed by nurses. The nurses will contact them so they can still remain in the community. But if they have serious symptoms, such as a sustained fever, short of breath, difficulty in breathing, then at this point, they need to visit the emergency ward. I want to say that aside from the designated clinics, private hospitals can also provide medical support. So whether it's a designated clinic or a private hospital, the parents can use designated taxis. They can use the designated taxis and visit the clinics or private hospitals door to door. So health department also has a team of private doctors that can support parents. We will keep an eye on the figures and deploy resources, so we don't have a fixed figure. We have set aside bed space. We also have some arrangements for parents who wish to accompany their children. So if they wish to do so, we can make these arrangements. So as the number of cases decrease, has the government considered stopping the mandatory testing of buildings? Now, regarding mandatory testing, or the government policy is to monitor sewage. So every day, the Environmental Protection Department and the Water Supplies Department, they visit designated buildings or temporary collection points, and they collect sewage. They will try to identify invisible transmission. Currently, even though with infection figures coming down, this measure is very necessary to help identify invisible transmission, especially when we have more arrivals arriving in Hong Kong. We need to identify invisible transmission in order to cut off the transmission. So looking at the previous figures, when sewage tests positive, especially when the concentration is very high in buildings, then testing can successfully identify invisible transmission. So when we deploy testing, we can prevent further transmission in buildings. In the imported cases, do we have any mutation cases? And the day 12 case, were there any other positive cases in the building? And a 7-day quarantine period, is it not safe? So with the new variant BA.5, is it possible that it would be spread into the community? Shouldn't we have 14-day quarantine? Now, on your other 3 imported cases, where did they come from? Which hotel did they stay in? Also want to ask, some experts forecast that every winter public would need booster shots. So how would health department assess that? Do we need booster shots? So the recovered patients might feel that they have immunity and they engage in more social activities. How would you assess that? And you said that there were some diseased patients between 23rd of February and 19th of April. Could you confirm the dates? I heard it was 19th of April. Now, regarding the mutation, the public laboratory has been conducting DNA analysis, and we've only identified one BA.5 case, and that was announced previously. It involved one arrival from South Africa via Ethiopia, and it was detected at the airport. So the public laboratory will continue to test, will conduct DNA analysis of arrivals in Hong Kong. Our airport temporary collection point, when they discover positive cases, these samples will be sent to our laboratories for further testing and DNA analysis. We have not identified any anomalies or variants. Regarding the day 12 case, we had stated previously that there were no symptoms, so the patient had no symptoms. And on the day 12, it tested positive, a very high CT value, and we believe that it was a reinfection case. So we need to monitor the situation. Now, typically, with imported cases, we can usually detect them within 7 days, so that measure is effective. Now, ever since the 14th of April, aside from testing at the airport, if they go to the quarantine hotel, if they test negative, they still have to do a RAT test every day, and on the 5th day, they need to do a PCR test. Because the PCR has higher sensitivity, we believe that is a safe measure. And on the 5th day, if the PCR is negative, then on day 6, 7, the RAT is negative, then they can leave the quarantine hotel safely. And when they return to the community between the 8th and 14th day, they still need to do a self-health check. If there are symptoms, they need to seek medical assistance. And on day 12, they need to do a test at the community center. If they test positive, then these imported cases, we will conduct analysis to see if it's a new infection case or whether were they infected after leaving the quarantine hotel and got infected in the community, or is it a reinfected case? If they have high CT values, it might be a reinfected case.
As to whether we need to have the vaccine every winter, it all depends on the scientific data. And normally after vaccination, the vaccines will not be effective for life. It's just like the flu shot. As time goes by, the immunity would wane, as though every so often there may be a need for another jab. And also the virus can also undergo changes, and it would be effective to have another shot. The scientific committee and the expert panel will have regard to the scientific data on a regular basis to see whether there is a need for the 4th shot or even the 5th shot. As to the last question about the recovered patients, whether there is a need for any social distancing measures, and the answer is yes. The recovered patients may have recovered, but it is likely that they would be reinfected. So after recovery, the patients should still keep the mask on, and they should observe the social distancing protocol in order not to get reinfected. Thank you very much, HK01, for the question, and I have the opportunity to make the correction. The figure that we report from February 23rd to April 16th, that these are backlogged figures. For the designated clinic, the number should be 23. Now, I mentioned MIS-C. It is post-COVID inflammatory syndrome. Let's make the last question, please. AM 730. About the day 12 imported case, what flight did she come back on? And also for the 9 cases picked up at the airport, other than TK083 and MX705, what other places did they come from? Now for the day 12 case, now how do you conduct the investigation? Will you be contact trace the cases that have been imported into Hong Kong? Now, you said there are 3 similar cases after April 1st. Are they regarded as local case or imported cases? And also, isolation order, the computer would work out the dates, but some said that 2 people are declaring on the same day, but the way in which the days are calculated are different. Other than the day on which someone tests positive, what other factors do you consider when calculating the dates? Right. Thank you for your question. For the day 12 case on April 5th, she came to Hong Kong on NH818 from Tokyo. Normally, we would have the compulsory testing. If one is vaccinated, one has to serve a quarantine for 7 days. On day 12, one has to be tested at the community testing center. The idea is that there may be cases with longer incubation period, or there may be a situation where transmission is taking place in hotels, then we can take relevant measures. Now, for this case, we will look at whether there are any symptoms, and also the CT value, and whether there were any previous record of infection, whether the people, the accompanying people are also infected to ascertain whether this is a new case. If the CT value is low, then we might suspect there might be transmission in the hotel or there might be transmission in the community. Now, from the previous cases, the CT value was high. I don't have the precise details with me for the previous 3 cases, but they are all classified as imported cases. They are repositive cases. They may have been infected overseas. Now, we get to see these from time to time. The second question about the isolation order, the calculation, is that the day on which the positive, one test positive would be the first day. It's not the declaration date. So on the platform, we would ask the patient when the specimen was taken. Now we would start counting 14 days from that particular date. There is a rider on day 6 and 7. If one is double vaccinated, if one tests negative, then one can resume normal life. So if there is any difference, I mean, if the specimen day is different, the isolation period would be different too. Do you mean at the airport? Right, let me say again about the imported cases. There are 13 imported cases, 1 from Shanghai, 1 from Korea, 1 from the UK, 2 Singapore, 1 Australia, 1 Germany, 1 Qatar, 1 Canada, and 4 France. The speaker not speaking through. I don't have the information with me. That's where we end the press conference. Thank you all very much.